the room.
Hello.
Hi.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP practice. Can I please kindly confirm your full name and age, please?
Yeah, my name is John Anthony, and I'm 50 years of age.
Very, very nice to meet you. What can I call you today?
You can call me Anthony.
Anthony. Okay, that's great, Anthony. I understand that you're here for follow-up and that you came last week. Is that
Yeah,
right?
that's right. Yeah, that's right.
Okay, and can you just walk me through what happened last week and what made you come in the first place, if you don't mind?
Yeah, so doctor, I came because of my wife. Well, she asked me to come in and get myself checked, just a
Okay.
regular checkup.
All right.
Yeah, so that's why I'm here, and they just did some tests. And yes, I'm here to get a follow-up for the tests.
Okay, that's great. Well, thank you for coming in firstly. I think it's really good that you decided to come in. It's always good to have yourself checked up. Yes, just to confirm, last week you did have some blood tests. Sorry, you did have some tests done. They measured your blood pressure. I think they sent you home with that as well. And they measured a few things, including your weight against your height, isn't it?
Yeah, that's right. Yeah.
Okay, that's great. So I am here today to discuss the results of those and have a general discussion about lifestyle modifications and things like that. Before I do that, though, I just wanted to take a quick piece of information from you to help me assess you better. Is that okay?
Yeah, that's fine. That's good.
All right, that's great. So have you by any chance had any symptoms such as, chest pain or shortness of breath or anything like that?
No, nothing like that.
Okay. Any heart racing?
No.
Any pain in the legs at all?
Nothing. Yeah.
Nothing like that. That's good to hear. Have you been recently unwell in any way, a fever or temperature or anything like that?
Well, not that, but I generally just get stressed a lot. So it's
Okay.
just that. Yeah.
Okay, I see. You're getting stressed. Right, okay. Can you tell me more about what's stressing you? Thank you for telling me that.
Yeah, well, it's my job actually because I'm a businessman, right? So it's just work stress. That's it.
Just work stress,
Yeah.
really. Okay.
Yeah,
You're a
and that's
businessman.
mainly causing me, a bit of everything, and then that's why my wife asked me to go and get myself checked. Yeah.
Okay, fair enough. That's
Yeah.
very important. Yeah. Okay. In terms of the stress you're going through, does it lead you to have any symptoms like maybe feeling down at all or anxious?
No, not that, but just stress in general. Yeah.
Just stress in general. Okay. Again, thank you for sharing that with me.
Mhm.
And has the stress affected your life in any way? Has it stopped you from doing activities you enjoy doing?
Well, no, not
No,
like
not
that.
really.
I don't
Okay.
generally have time for stuff
Mm,
like exercise and all. Yeah.
okay. And do you have any main concerns or worries about today at all that you would also like me to address?
No, it's just that is there anything wrong with me or not? Yeah.
Okay. Oh, absolutely.
Yeah.
I'll go through that with you in a second.
Yeah,
I
sure.
just want to ask some general background health questions. Some of the questions might sound irrelevant. Please bear with me. I do need to ask them. Is that okay?
Okay. Yeah.
Okay. Yeah. So have you ever had any heart problems at all?
No.
Any strokes in the past?
No.
Okay. Are you taking any medication at all?
No.
Okay. Have you ever been told that your blood pressure is high or that your sugar levels are high?
No.
Okay. Have you ever been told that you have high cholesterol levels?
No.
Okay. Do you by any chance have any conditions that run in the family?
Well, blood pressure runs in the family. I think
Blood.
hypertension, that's called. Yeah.
Yeah,
Yeah.
hypertension. Okay.
Yeah. That's it.
Okay. All right. And has anyone in your family ever developed any heart problems or strokes in the past?
No.
Okay. Thank you so much for answering my questions. I just want to know a bit more about your lifestyle and who else is at home. I know you said that you work as a businessman and that you're stressed. I hear you, and I'm going to
Yeah.
help you with that as well and give some
Yeah.
advice. Do you by any chance smoke?
Yes, I do.
Okay. How much do you smoke?
It's been quite a time now, 18 years now.
18 years.
Yeah, so a pack or two daily. Yeah.
And do you drink alcohol?
Yes, I do. 2 glasses of wine daily.
Okay. Okay. And can you tell me a bit more about your diet? Do you eat out or do you cook at home?
Well, I eat a lot from outside, and I don't have time for cooking myself,
I
and
see.
I'm generally at the office every single time, so I don't get time to eat at home.
I
Yeah.
see. Okay, so you really don't have time to eat at home. What kind of foods do you eat when you order out?
Well, it's just the junk food, to be honest, KFCs and
Okay.
chicken, fried. Yeah.
I see.
Yeah.
I see. Okay. And do you find time to move around and exercise?
No, not actually. Yeah, so I'm
Okay.
busy with work.
Okay.
Yeah.
Okay. Well, again, thank you so much for answering my questions here. We did your blood pressure reading,
Yeah.
and the average came back as a bit high, 165 over 95.
Okay.
Okay. And so I'll discuss that with you. And we also looked at your weight against your height to give us an idea of how healthy someone's weight could be. Yours came back as 28, whereas the upper range of normal is considered to be 24.9.
Oh, okay.
So what that tells us is that your weight is high on the higher side and that your blood pressure is also quite high. And they also calculated a Q score, which is a score that gives us an idea of the risks of someone having heart problems in the future or stroke in the future. I need you to know, obviously, that that doesn't mean it will happen, but it gives us a good idea of the risk. And yours came back as 16. And if you get a number between 10 and 20, that means it's a moderate risk.
Okay.
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 So what I was hoping to do is I was hoping to talk you through the medications that we could potentially offer, some of the lifestyle changes that could also help in lowering the blood pressure and lowering your weight, which will all work in your favor and really change how you feel as well as your general health. Is that okay?
Yeah, that
Yeah,
sounds
which one would you like to
fine.
go through first?
The medications and the lifestyle. Yeah,
Okay.
just anyone. Yeah.
Okay, so in terms of the lifestyle, going through stress, like you mentioned, definitely
Mm-hmm.
contributes to high blood pressure.
Yeah. Yeah.
And I know that, sometimes you've got to work hard, but
Mm-hmm.
having someone to talk to, such as a counselor, is something that can help as well. But also, another area that can really help with stress that you might find useful is exercise. And
Oh, I
I know
don't have any time for that.
Mhm.
Yeah.
Yes, that's true. Have you tried perhaps maybe taking the stairs when you can, parking a bit further away from where you want to go so you can walk? You just really need to get about 150 minutes of brisk walking for your exercise needs.
Well, I can give it a try.
Okay, that's
Mm-hmm.
good. That's good. Um,
Mm-hmm.
two very important areas to talk about as well is the smoking. Have you ever
Mm-hmm.
considered quitting smoking?
Well, I haven't.
Would you be interested in me referring you for smoking cessation?
Mm, well, I have to think about that
Okay,
because it's something I've been doing it for a really long time.
of course, it's understandable. I just want you
Mm-hmm.
to know that nicotine is is the thing that makes us keep going back to smoking, and tobacco is the harmful
Mm-hmm.
substance. And nicotine replacement is to try and give you nicotine for the cravings, whilst replacing the harmful substance that causes heart problems and strokes and vessel problems. And so, I
Mm-hmm.
really, really want to move on to the next station.
Okay.
Feedback.
Well, there's a lot to do in terms of the Q score and lifestyle and all that stuff. So it's a long station, anyways.
Mhm.
But yeah, a bit more organized, I think, would have been made it easy kind of way
Mhm.
to complete it in time. Because
Okay.
obviously it's kind of different from other generic consultation because
Mm.
it's more focused towards the lifestyle and all that
Yes.
stuff. And generally people do take time because diet and all that stuff.
Mm.
Right. So yeah, but then you kind of covered it as well. So it's a pass from me, and you explained like what Q score is. You always like made me comfortable because you're not going to have it. It's just a way to. So it was a good one, but obviously there's a room for improvement.
Mm.
Yeah. So the time management, I think, could have
Yeah.
been better. Yeah, that's it.
Time
But then
management.
it's a
So where
pass
can we manage the
anyways.
time?
Yeah.
I think we can manage the time very early by just putting any concerns out there quickly and
Yeah.
then
Yeah.
taking a very brief PMAF dosar as
Yeah. Yeah.
opposed to
That's
very
right.
specific and not looking for anything so that we can quickly
Yeah,
talk
and then
about
more
the
focus
findings.
towards Endesa because that's where you'll
Mm.
get the things and cues, and
Yeah.
then you'll get
Okay.
because that information would be there anyways. Yeah,
That's great. So what I'll do is I'll do another one of these kinds of ones as
sure.
well myself. Is there anyone you wanted to also do as a simulation today?
Yeah, there was one with cough.
Okay.
Mesothelioma. Yeah,
Okay. All right. Yeah,
yeah.
sure. We can do that. That's respiratory, but that's fine. I think we talked about a lot of shortness of breath and coughing and how to take history for the
Mm-hmm.
para. We did the history taking. I think later Dr. Zishan is going to join us and he's going to go through the respiratory scenarios.
Mm-hmm. All right.
So what we can do maybe is that we could save that for doing it with Dr. Zishan. And instead what I could do is I can do another Q score and attempt
Sure.
to make the changes that you just said now.
All right. Yeah, that's
Yeah.
perfect. Yeah.
Yeah,
Yeah,
I
that's
think
good.
that's what we'll do. So let's take the next scenario and then I'll
Mm-hmm.
try this one out. Again,
Okay.
very similar background. These don't change much, guys. They're always going to give you, again, this guy came for checkup. Maybe he's a businessman, busy lifestyle, smokes a lot. Wife is also busy, no time to cook, significant amounts of alcohol. And, they may agree to cut down, this and that, always late. So, taking the stairs won't work for me. So I just want you, again, stay free and just, change your
Yeah, yeah.
concerns. We don't have to stick to anything. We can do
Mm-hmm.
anything because it's important just to be able to manage the time. So today the target is for me to get that time management down. I'm going to change some of the way I approached it so that I can perhaps see how it's done better. Okay, so we're going to time this again for 8 minutes. Just to give you guys a rundown, this scenario is a 60-year-old male who came for follow-up. He had a blood test done last week, all normal, ECG normal. The BMI is high, the BP is high, score is 9.1. Okie dokie, let's go.
Mm-hmm. All right.
Begin. Enter the room. Hello.
Hi.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just confirm your full name and age, please?
Yeah, my name is Sam Matthews, and I'm 61.
And you're 61. Very nice to
Yeah.
meet you. What can I call you today?
You can call me Sam.
Okay, Sam. I understand that you're here for follow-up. Is that right?
Yeah, that's right. Yeah.
Okay. You had a few blood tests done last week, isn't it?
Yeah, that's right. I'm here to just get whatever's there. Yeah.
Okay, yes, today I'm here to explain the results with you, talk about some of what the results mean in general. Before I begin, is there anything from your side that you'd like to discuss at all?
No, just here to get my results. I just want to make sure that nothing's bothering or,
Okay,
yeah.
that's great. How's your general health been? Have you had any troubling symptoms or any concerns with your health at all?
Not like that. Just here and there stresses.
Okay.
That's it. Yeah.
Okay. Okay, that's
Mm-hmm.
great. So we did a few blood tests and we also measured your weight against your height for a reading known as
Yeah.
BMI to tell us how, how healthy your weight is. We measured your blood pressure as well. And we did
Okay.
something known as a Q score. So I'm just going to walk you through each of the results quickly. Your blood
Okay.
tests, firstly, they came back normal, which is good. Your the cholesterol, which is a fatty substance, came back as normal. Your
Uh-huh.
kidneys are functioning well. Your liver's functioning well. Your ECG, which was the tracing of your heart, was also good. So that's all normal.
That's good.
But there was obviously a few things that didn't come back as we would have hoped for. Your weight against your height was on the higher side. Usually, 24.9 is the upper limit of when we consider someone's weight to be healthy when we measure it against their height. Yours was at
Okay.
28.5.
Okay, that's way above. Yeah.
So it just means that your weight is slightly on the higher side.
Mm-hmm.
Okay.
Okay.
Your blood pressure is another one that came back as high.
Okay.
And when your blood pressure is high, it means that your heart needs to work much harder to pump blood through the vessels. And so, that's something to consider
Okay.
there as well. Yeah.
Okay. Yeah.
Okay. We measure the score. The
Mm-hmm.
score is called a Q score. Now, it might sound a bit troubling, but the
Mm-hmm.
score is just to assess the risk of the potential of someone developing a heart problem or a vessel problem in the next 10 years or so. It doesn't actually
Okay.
mean you'll get a heart or vessel problem in the future. But
Mm-hmm.
it's something that gives us an idea of the risks. And yours was 9.1. So it's low risk because low risk is up to
Okay.
10%.
Okay.
Okay.
All right. Yeah.
But that means that there are a few things to discuss in terms of how we can continue to reduce those risks. Okay.
Okay. Yeah. Yeah.
Now, if you don't mind, I want to ask about your background health. Do you have any medical problems at all?
No.
Okay. Are you on any medication?
No.
Do you have any allergies at all?
No, I don't.
Okay. Are there any conditions that run in the family?
Well, there's diabetes and there's hypertension.
Okay.
Yeah.
Okay. And how are your relatives doing? Are they okay?
Yeah, they're fine.
That's good to hear. Okay. In terms of your occupation, may I ask what you do for a living?
Yeah, so I work in IT
Okay.
and most of the time I'm just in front of the computer.
Okay.
So
So you're
yeah.
not moving around too much, are you?
No,
Okay.
no.
All right. And just a bit more about who else is at home. It helps us understand things. Do you live with
Yeah,
someone?
so I live with my wife and daughter.
Okay. And how's everything
Yeah.
at home? Is it okay?
Yeah, they're
Yeah.
good, yeah.
Okay. Any stresses or worries in life at the moment?
No, no, nothing like
Okay.
that. It's just that the weight just goes ups and down,
Yeah.
and then
That's
I can't
fine.
do anything about it because
I
I'm
see.
obviously doing work and all.
Right. Okay. Well, I can talk to you about ways that we can try. Do you
Mm-hmm.
smoke?
Well, yes, they do.
And how
Yeah.
much do you smoke?
So I smoke like a pack is every single day, and it's been
Mhm.
like 15 years now.
Okay. And do you drink alcohol?
Yes, I do.
Okay. How
I think a bottle every single day.
Okay. Okay, bottle a
Mm.
day. And thank you for answering my questions again.
Yeah.
You really get to move around as well. When we usually advise on lifestyle modifications, it helps to do a few things. It helps reduce the risks by helping in terms of lowering the weight, for example,
Hmm.
other things. And I just want to talk to you about some of them. One of the main ones I wanted to talk to you about was smoking. In terms of the smoking, it's one of the major factors for heart problems and vessel problems. And because
Okay.
tobacco smoke contains a lot of harmful toxins. Is
Hmm.
that clear? Now, would you be willing for me to refer you for smoking cessation
Well,
services
I've
where
tried before and that
Mm,
didn't work for me. So I think I can give it a try again.
that's great.
Yeah.
That's great.
Yeah.
What they usually do is that they would offer you nicotine replacement therapy.
Yeah,
And
yeah, yeah.
this, yeah, have you heard of that already?
Yeah, I do.
Okay, that's good to hear. Okay,
Hmm.
so thanks. I think that's a great step. That's a positive step. Another area is in terms of exercise. Moving around is really one of the ways that you lose weight. You mentioned that you don't get to move around a lot. Are there
Yeah,
any
that's right.
activities you enjoy doing?
Well, not really. I don't have any time for any of that.
Hmm. Okay.
Yeah.
Sometimes it helps to just walk briskly, 2 minutes, and walk really quick, get the heart rate elevated. Sometimes dancing can also count for your exercise and things like
Okay.
that. Taking the stairs, would that work for
Mm.
you?
Well, I've tried taking stairs. That didn't help me.
Mm.
So what else could be done?
I can refer you for weight management services. They would give
Okay.
you dietary advice along with exercise advice.
Mm-hmm.
and really
Okay.
work with you closely. That might work for
All
some
right.
people as well. Is
Yeah,
that
that
something you'd like?
seems like a plan. Yeah.
Yeah. Okay. Good. Good. That's good. So anyway, about your diet, can you tell me whether or not you cook at home or you eat
Well, I
out?
don't have time for that, and my wife,
Mhm.
she works as well.
Okay.
So, we've got different timings anyways, and we eat,
Mhm.
from outside most likely.
Right.
And it's
Mhm.
just a day, and we don't eat greens at all.
Okay.
So, yeah,
So your blood pressure was high, and so
yeah.
what I wanted to talk to you in terms of the diet and how that could affect you in different ways. First thing is, having oily or fatty foods in the diet generally
Mm-hmm.
increases the fatty substance cholesterol, and
Mm-hmm.
also what that then leads to is that the blood has to be pumped by the heart at a harder rate because the pressure is a bit high.
Mm-hmm.
Change some of the foods you eat and you put some exercise. It really does help in lowering the blood pressure.
Okay.
So obviously it's not easy to get it right. Maybe going for healthier options with grilled options instead of fried options, and thinking about
Mm-hmm.
reducing salt to about a teaspoon's worth of salt in a day. These could initially help. And if you'd like,
Okay.
I can refer you for dietary services as well, and more information on that.
Yeah, yeah. But just that we don't have any time for,
Mm.
preparing food.
Move on to the next
So,
section.
yeah. All right. Thank you.
Blimey, hell. Okay, I tried. Tell me.
Yeah. So it was better than before.
I
Yeah,
had
to
a
be
lot more
honest.
time, isn't it?
Yeah, that's right. And then you that kind of covered everything. The approach I loved, and this was you forgot to take like about diet in the start, but then you knew I would because in the management point, you have to take the diet. So you asked
Yeah.
the question and then you managed it. It was really smart,
Thank
smoking
you.
and then going that way.
Yeah, things can happen. Things can
Yeah,
go wrong, I think.
yeah,
I
but
think
then
Dr.
it
Zishan is
was
here as well.
yeah, so it was a perfect one to be honest, because you kind of covered, and then you also like told the Q score part as well. So I think that would have been approached this way, and then you managed to complete the time as well. So it was a good one. Yeah.
Yeah, I think if I do it a third time, I'll be
Yes.
perfect.
Hello, guys. So,
Hello.
my dear,
Hi.
yeah,
Hi.
well done, Radwan Ali. I couldn't stop telling that this is one of the best consultations should be done, followed, and you meet the criteria. But you may slightly strict at the moment, but this consultation meets the criteria
Yeah.
because I want to quickly debrief and regarding the concern, yes, address the concern. Have he done the DDs, differentials, red flags in terms of that? If the patient is having anything at the moment or not, that was perfectly done. Then coming to DESA, well done. And when negotiation point, because you have to tell someone that you should be doing this, but in a way they love it. That was perfectly done. Dancing stuff, telling about the stairs, perfect, and the curious part as well. So I would say this consultation is one of the best consultation.
Yeah.
And what we will be doing, who's taking the course, we will make a short of this recording part because this consultation meets the criteria, and we'll sending you and the Mariam added some points. Yeah, definitely. There will always a room to improve.
Yeah.
But for me, this consultation is 12 out of 12. And
Yeah.
well done, Ali.
Thank you.
So,
Appreciate that.
see you after 2:30, guys. I'll be taking over the session at 2:30. And now Radwan Ali will do the rest of the algorithm part of the QDisc, and then I'll
Yes.
meet you at 2:30.
Sure.
All right, guys. Yes, we do have to quickly go through the rest of the algorithm. Thank you so much, Dr. Mariam. I think you'll be doing if you mesothelioma with Dr. Zishan in the later section as
Sure.
well.
Sure.
It's always a pleasure working with you and seeing you.
Mm.
Dr. Nida and Dr. Mariam are both, very well versed in the Plab. They passed with very, very high marks, and they have also got teaching and mentoring experience as well. And they join us daily as well to do these simulations and to really do things practically as well as teach them. So thank you so much, Dr. Mariam.
Thank
If you've
you.
got anything
Thank you.
else to say,
No, it was
yeah.
lovely. And then I just want to let people know that I'm one of the students for Dr. Radwan. So you are investing in this in a great thing. And then inshallah, you all will pass. So yeah,
willing,
so
yes.
keep up the good work. Yeah. So see you around after 2:30, everyone. All right, bye.
All right, bye-bye.
Bye.
So let's go through the other sort of Q risk-ish looking scenarios. I think we have noticed one trend, right? We have noticed one main trend, and that is simply that things will always be similar in terms of the problems. Yeah. So the first one was somebody with a high blood pressure, Q score and BMI. Again, it was lifestyle issues. Again, this person had a BMI 28.5, 160 over 105, and had these sorts of lifestyles. Third one could be a female who came for the follow-up at the GP. We've got some added extra things. Cholesterol on 2 occasions was 6.2. So again, what's cholesterol? It's a fatty substance that builds up in the blood vessels sometimes, and it can lead to blockages as well. So her Q score is 14. That's a moderate risk. She's already planned to start on statins. And just to give you an idea, any scenario where the Q score is moderate and to high risk, 16 was over here. These you would suggest statins, but definitely lifestyle is important to talk about. Good. Patient information here again. The patient may not know what the BMI is. You may need to explain. The patient doesn't smoke in this particular instance, perhaps. Drinks about a glass of wine a day. So alcohol is obviously important to discuss. 14 units in a week. Eats fish and chips and loves hanging out with friends. Likes to dance and goes golfing with the husband. Hates exercise. But guess what? Golfing is walking. If you walk a bit faster, that can count. Dancing is amazing. It really does get your heart rate going, and it can actually count as vigorous intensity exercise. You'd only need to do about 75 minutes of that, and you can put that into your life if it's something you would hope for. Housewife is her occupation, but it could change, and that doesn't matter. Question-wise, will I be on statins for the rest of my life? Am I obese? So again, 28 is not obese. It is overweight. It's classified as overweight. And so the marker for obesity is a BMI of around 30. Will you be on statins for the rest of your life? So it is important, Mrs. Johnson, to know that the reason why you're being placed on statins is because your cholesterol levels were quite high on 2 occasions. And what that means is that you would need the statins to lower your cholesterol. And it's possible if you don't take the statins, your cholesterol levels could increase. But that isn't to say that there aren't lifestyle changes that can also help lower your cholesterol. And so if you tried the lifestyle, you don't necessarily have to be on statins for the rest of your life. We can always do further blood tests and keep checking and advise you as needed. The choice is definitely yours. So yeah, it's patient-centered. Again, we know that people, when they're started on statins, it's likely they might need it for the rest of their life. But actually, it's all dependent on the cholesterol levels as well. And some lifestyle changes definitely help. What can lower cholesterol? Switching out from any, some cakes and cheeses and all of these sorts of really fatty substances tend to raise cholesterol, including red meat. And the things that lower cholesterol is to, maybe use olive oil, try to grill instead of frying food, which has oils, and also healthy fish portions, 2 portions of fish in a week and things like that. So further reading is to check varied and balanced health advice on NHS itself. Remember, there's a lot to go through. We need to just aim for the patient, and where we learned we can manage the time is that the initial history, we actually keep it very brief and very open, and that way you have a lot of time to manage as well. I also want you to know that in the scenarios, your patients, they're very well trained, and that they will have very specific areas that they say yes and very specific areas they say no, so that they also know they need to act accordingly, so that it's allowed to be done in 8 minutes. So that's also something for you to consider. The Q score one more time: low risk is less than 10%. More than 10%, we tend to start offering statins, okay? 20 mg, if the person decides to take it. We never force anyone, and it's not the end of the world if they don't want to take statins. Lifestyle changes. I think in my simulations, I didn't get to cover alcohol, and make sure that you understand it's either alcohol-free or it's less than 14 units and alcohol-free, depending on the units. So let's talk about the units. It's important you know how to calculate the units very, very quickly. So just here, I'll tell you immediately how it is. So something that's small, 1 shot. A shot of alcohol is very small. It's a very small amount. It's 1 shot. Another one is a glass, small glass. So you have 3 size glasses, and this will allow you to also create the alcohol units. Yeah. So think the most common beverages that you'll find is wine, which is drank in a glass. And there's a small glass, there's a standard sized glass, and there's a large glass. So small glass and shots, 1 unit. Standard, around 2 units. Also beer, you can have a can of beer, just a regular can of beer, and that's going to be 2 units. And then you have the big pints and the lagers. These are 3 units. The big glasses, they are 3 units. And I think a bottle of any alcohol mostly, okay, and you don't have to memorize everything properly, you just need to know the general idea. A bottle could be up to 24 units in a bottle, just to let you know. And so if somebody's drinking 1 glass of wine a day, it's important to say, okay, is it a small glass? Is it a large glass? Let's say it's a large glass of wine every day: 2, 4, 6, 8, 10, 11, 12, 13, 14. Somebody can drink a glass of large wine every single day for 7 days, and it would be at 14 units. The only problem is that we should also advise on having alcohol-free days. So that's a good marker. So that means if I'm having 1 glass a day of wine for 7 days of large, standard glass, sorry, not large, standard, that would be 2 units, and 2 times 7 is 14. So that's your marker. In any case, we now are ready to do a few more of the algorithms together. Make sure we cover more before we get to Dr. Zishan at, I know it's 1:30, but I just want to do a couple more, make sure that we don't leave too much left over. Usually leftovers are covered on the final day. Also, the masterclass will cover high yield and make sure that we cover the things that are coming recently as well. So I think without further ado, I go to the sketches again. Here we go. pericarditis quickly. For pericarditis, I want you to have a look here. We are usually, obviously question time is always open. Please type if you have any questions. So for pericarditis, again, can you tell me more? It's the Socrates as we knew it. We also want to know if the pain has any positional, bad or worse. So that's important as well. Other GDs, remember, it's the chest, pneumothorax. What were you doing at the time? Any injury? Pericarditis specific question is any recent flu-like illness. Sweating is there. Vomiting is there as well, sometimes for MI. Leg pain, swelling, we're looking at PE, DVT, heart failure, and things like that. The difficulty in breathing must be there. There's a triad to always ask about. If someone has chest pain, also ask about coughing and ask about shortness of breath. Good. Some risk factors include long flights, fever, a recent flu-like illness, or rash. Again, pericarditis is known to cause pain that is relieved by leaning forward. PMAF-TOSA. Time for the PMAF-TOSA. And again, we are very good at taking general background history and the DESA as well. Psychological and effects, any problems at work, home, or driving may not apply in an acute scenario. And so it's there to remind you as well. It's all about managing your time. Even though the sketches are there, we will show you how to just manage time, and we'll try to do it with you guys as well. For your ice, I think ideas is the most important. Is there anything, have you given any thought as to what could be causing your symptoms? I'll tell you why it's very important to ask ice in chest pain, because sometimes somebody could be having a panic attack in a young female. And if you ask the ice, she might tell you, I don't know, I think it's probably because of what happened. And then the more clues come. So ideas is very useful. Good. And also it's important you never skip these too much. I know that I said that it's not as important. That means you screen. When something's not as important, it doesn't mean you skip it. Maybe it means you screen. So when I was changing my approach in Q-Score, first I was asking very detailed initial histories. Then I realized that takes a lot of my time and doesn't allow me to manage. Instead, I allowed the patient to take control, and I asked very general questions, and I just covered things in general. So here, similarly, somebody came with chest pain. I'll just ask and screen, right, can I just know, you mentioned that the chest pain has been going on for 2 weeks. I just want to know a bit more about how it's affected you. Has it caused any problems? Are you going through any anxieties or stresses in life at the moment? You screen 2 questions. If you asked and it's anxiety, panic attack, and you say, are you going through anything stressful at the moment? It's because when I was asking all of my red flags, the answers were kind of like no. The only thing was impending doom, and obviously chest pain. Good. Your observations will usually be normal when you do your examinations in anxiety or panic attack. But in pericarditis, which is the focus of this conversation, you need to request an ECG, and you can get widespread ST elevation on the ECG and obviously raised infection markers, CRP, ESR. So the management usually is conservative unless the cause is bacterial. So you do need to obviously do some cultures and make sure it's not a bacterial, but the person said I had a flu-like illness, making it more likely to be due to virus. Explain the findings first, and then explain that we did a tracing of your heart, and it showed that the electrical activity in your heart suggests that you have pericarditis, which is an inflammation of the linings surrounding the heart. Is that clear so far? Usually, we give you what's known as NSAIDs. They are non-steroidal anti-inflammatory drugs to reduce the inflammation around your heart. So we'll be prescribing you some ibuprofen. If there is any reason, allergies, asthma, or anything that contraindicates the use of NSAIDs, colchicine and steroids as the last resort, if it's not getting better within 2 weeks. Good. We'll make sure it's not an infection that would need antibiotic treatment. It really feels like it's viral at the moment. We'll repeat some of these tests, but because we're concerned about how unwell you are, we may need to admit you today. Or they came to the ED and we need to keep an eye, make sure they're okay, and then we can send them home. Management of the issues. Again, am I having a heart attack? Could be the patient's issue of concern. And so make sure that when you are explaining some of these things, you reassure them that it's not a heart attack, but it is inflammation of the heart. In the future, if you develop any severe crushing chest pain that goes to your neck or jaws and doesn't go away and lasts very long, please call 999 because that could be a heart attack. I'll give you some leaflets. Okay. So how does that look like in terms of your scenarios? I just want to show you the ECG quickly. It's a very straightforward scenario, guys. It's not very hard. There you go. So the person will have dull pain everywhere on the chest. It's worse when lying down, especially on the left side. It's worse when breathing in and swallowing. So these are all potential things they tell you in terms of what makes it worse. Sitting forward makes it better, doctor. They had a flu-like illness and they want to go home. And this is managing the patient concern. Wanting to go home. And this is the final thing I'll say before we go for lunch break. Wanting to go home is the management of the patient's concerns in this particular scenario. So I need to tell the patient, hey, At the moment, not hey, but yes, Miss, Samantha, at the moment, we've done your ECG and it's come back with widespread elevation, ST elevation. This basically tells us that your heart is affected, and it tells us that there's inflammation around your heart. Usually you'd be able to go home, but we just need to make sure that we take all the necessary steps and make sure it's safe for you to go home. So I will involve my seniors as well. We're going to give you some medication to reduce the inflammation. It's called, non-steroidal anti-inflammatory drugs. We will also do more blood tests and repeat some of the ECGs and repeat some of the infection markers that we would like to make sure we rule out as well. So once that we've ruled that out and you're not doing too badly, and we'll check, your oxygen levels, your breathing, some of these things. Once you stabilize, we'll be able to send you home. And if you're really unwell, we might ask you to stay with us for a while. Something like that. Again, that's managing the patient's concern. And what they don't want and what they're testing and what they're looking for is basically somebody who says, things very bluntly, without sensitivity. I hope the body language today was helpful, guys. And when you guys come in to the UK Pass Academy, we have supervised mock sessions, and we really do this all together in a room, and we really all see each other doing. We help each other improve, specifically in a personalized way. There are mocks available as well. We're going to take 1 hour lunch break. I know I said 1:30, it's 1:36. Please come back at 2:30. And as always, your feedback is always important. If you've enjoyed the classes today, please leave us a review.